Michael Douglas. He is facing another challenge, and as Robin said, it has been a difficult year, a health crisis that could affect his career and his life.
My name is Andrew Shepard, and I am the president.
He is a Hollywood legend, and at 65, Oscar winner Michael Douglas is taking on his toughest role after doctors discovered a tumor in his throat.
He will be undergoing 8 weeks of chemotherapy and radiation to take care of this problem. That is traditionally a very aggressive therapy.
Will it affect the commanding voice we all remember when Douglas played Gordon Gekko?
Greed, for lack of a better word, is good.
The iconic role Douglas will reprise in next month's follow-on to Wall Street.
Why don't you start calling me Gordon?
Douglas has released a statement to People magazine saying, "I am very optimistic."
There's no smoking in this building, Detective.
What are you going to do, charge me with smoking?
And Douglas has struggled with smoking in the past, which may have contributed to his current condition.
Michael Douglas, as recently as 4 years ago, has admitted that he was struggling with his own smoking situation. Smoking has been part of his life.
I'm off the sauce. I even stopped smoking.
How's not smoking?
It sucks.
Another possible factor, alcohol, which Douglas has admitted struggling with.
I think that I had developed a lifestyle over 20 years of predominantly alcohol abuse that needed to be corrected and checked.
His illness comes on the heels of a difficult year. In April, his son Cameron was sentenced to 5 years in prison for drug dealing. And last June, his ex-wife Deandra filed a lawsuit looking for 50% of his earnings from the upcoming Wall Street movie. And joining me now for more on the treatment Michael Douglas is about to undergo is the co-director of the Head and Neck Institute at Beth Israel Medical Center, Dr. Kenneth Hu. Thank you for joining us this morning. So we learned that Michael Douglas is going to undergo 8 weeks of radiation and chemotherapy. What does that tell you about the potential severity of this illness?
Right, well, it tells you that it's probably an intermediate stage cancer, not early stage, which is usually treated with surgery or radiation alone, or advanced stage, which is treated with surgery plus chemoradiation. But if he's getting just chemoradiation for about 2 months, then typically it's an intermediate stage cancer with good efficacy in terms of prognosis. The chemoradiation for 7 to 8 weeks usually results in preservation of the voice box and tumor control, over 3/4 to 80% of cases when they're properly.
That's the big advantage versus surgery. If it were more severe, he would have surgery, but that could end up affecting his voice.
That's right. That's right. There's been a lot of progress made over the past 15 to 20 years using less invasive treatments to try to not only cure the cancer, but maximize quality of life, swallowing, and voice function.
So what will happen over the course of this treatment?
Well, it's for the first few weeks of the treatment, he should tolerate it pretty well. He seems like a very healthy person, but near the end, it gets a little more difficult in terms of swallowing. His voice box can be affected. He can get more hoarse, ironically. The key thing that I think he'll need to understand is not smoking during the radiation treatment. Smoking probably caused the cancer, but smoking during the radiation makes the radiation less effective.
You say that smoking probably caused the cancer. How does that work?
Well, when you smoke, it goes through your whole digestive tract, through your mouth, into your voice box area, your throat area, into your lungs. So all of that area gets exposed to the smoke, which is a carcinogenic agent that inflames the area and promotes normal tissue to becoming cancer cells. And that's how a tumor develops in the throat area.
And I was surprised to learn this. How is it exacerbated by alcohol use or abuse?
So you got to think of tumor cells getting a long process. You get carcinogenic exposure and then chronic irritation, either by additional smoking or by the irritating effects of alcohol, promoting the development of cancer growth. So that combination is unfortunately a recipe for the development of a throat cancer.
But you say in this case, they seem to have caught it at a stage where it almost certain that in a majority of cases it can be treated.
Exactly. I think the fact that he's getting chemoradiation means that it's curable, and that he's got, in the properly selected situation, a very decent chance of preserving his voice box and having good quality of life and function long term.
So for everyone else watching this morning, what are the symptoms that you may have a problem like this?
Typically it's hoarseness. You might notice sore throat, some ear pain. In very advanced cases, you might develop difficulty
But there's so many
breathing.
other causes for hoarseness or sore throat.
Sure. And that's why, I mean, that's why it's probably hard to detect, because there's so few cases of throat cancers compared to breast or lung or prostate. It's very small percentage of cases each year. So you really need, you have a problem with hoarseness, to see a otolaryngologist, a ENT doctor early on, to try to detect it in an earlier stage.
Okay, Dr. Kenneth Hu of the Beth Israel Medical Center, thanks very much.